Welcome to this video series on cardiac arrhythmias, where in each episode we will focus on a different type of heart rhythm disorder. In every episode, we'll cover the definition, causes and risk factors, symptoms, electrocardiogram characteristics, treatment options, potential complications, long-term outlook, and key considerations for healthcare professionals. Today's topic is atrial fibrillation. Atrial fibrillation is a supraventricular arrhythmia characterized by disorganized and rapid electrical impulses in the atria. As a result, the atria quivers instead of contracting effectively, leading to an irregular and very often rapid ventricular response. Atrial fibrillation can result from a variety of underlying conditions, including hypertension, coronary artery disease, valvular heart disease, heart failure, sleep apnea, and excessive alcohol intake. When we take a look at the risk factors, men have a higher risk of developing atrial fibrillation. Age is a major risk factor, and it's more common to people with a family history of atrial fibrillation. If we take a closer look at the symptoms, patients with atrial fibrillation may present with palpitations, shortness of breath, dizziness or lightheadedness, fatigue, or chest discomfort. But be aware, some patients, especially elderly patients, may be entirely asymptomatic, making atrial fibrillation easy to miss out without a routine monitoring. We are now looking at a normal sinus rhythm. In a normal sinus rhythm, you have a clear P wave followed by a QRS complex and ending with a T wave. What's characterizing for a normal sinus rhythm is that the RR intervals should be consistent, with no more than 10% variation between every beat. If we take a closer look at the baseline, we can clearly see between every T and P wave a stable baseline. We are now looking at an electrocardiogram representing atrial fibrillation, and we can clearly see some differences comparing it to the normal sinus rhythm. First of all, it's an irregular rhythm. Next to that, there's an absence of distinct P waves. If we take a closer inspection to the baseline of atrial fibrillation, you can clearly see there's a fibrillatory baseline. Often we find quarter waves, but it's never a stable baseline. And there's a variable RR intervals between each beat. Looking at the treatment strategies of atrial fibrillation, we have rate control with beta blockers, calcium channel blockers. Next to that, we have rhythm control with antiarrhythmic drug or electrocardioversion. And then we have anticoagulation to reduce the risk of strokes, but also of other thromboembolic events, since atrial fibrillation is causing blood clots. So that's why you're always on anticoagulations. It's possible to undergo an ablation to take care of the atrial fibrillation. It's considered in a select group of patients, especially those who have a lot of symptoms. But the downside of ablation is that it's not always guaranteed that the atrial fibrillation is gone after that, so it's not the first choice of treatment. Without proper management, atrial fibrillation can lead to serious complications like stroke due to thrombus formation in the left atrial appendage, heart failure from prolonged tachycardia or loss of atrial contraction. It could also result in cognitive decline associated with silent embolies and reduced cerebral perfusion. If we look at the prognosis and long-term outlook, atrial fibrillation is a chronic condition that often progresses over time. With good management, many patients can live fairly normal lives, though recurrent episodes and complications remain common. When taking care of patients with atrial fibrillation, remember, always assess stroke risk, even in asymptomatic patients. Screen for reversible causes like sleep apnea. Monitor renal function and INR when using anticoagulants. Educate patients on adherence, especially with NOACs or warfarin. And consider shared decision-making in rhythm versus rate control strategies. Thanks for watching this video about atrial fibrillation. Understanding atrial fibrillation is critical to improve patient outcomes. If you found this video helpful, please like, share, and subscribe for more clinical content.